Hi, my name's Lesley Reid and I am the dietitian here at the Slimming Clinic. So today I am talking about weight loss and IBS. So what is IBS? So IBS is a disorder, which means there's a disruption in the function of your bowel, but there's not any disruption in the structure of it. So if they were to have a look at your digestive system, it shows that there's no actual structure problems, but there actually is a functional problem with your digestive system. IBS appears to be more common in people aged between 20 and 40, and it's twice as common in women as it is in men. When we look at the UK population, the average percentage of people that have IBS is around about 15%. The classic symptoms of IBS are pain, usually lower abdominal pain, bloating, which looks like bloating from just under your rib cage, and tends to protrude like a pregnant belly. There is urgency, so urgency to go to the toilet. There's what we call incomplete evacuation, so when you go to pass a motion but you don't feel that you get rid of it all. And there can be gurgling, so a kind of noisy washing machine sound that comes with the IBS, and there can be constipation, there can be diarrhea, there can be reflux, and there can also be heartburn. So these are the classic symptoms of IBS. The exact cause of IBS is unknown, but experts agree that it can be a hypersensitivity of the full digestive system. So when they've looked at studies, it appears to be people who have IBS are more prone to feeling discomfort and pain with their digestive system compared to the rest of the population. There also can be a genetic link. So if your mum, dad, brother or sister tend to have heartburn or constipation or diarrhea, that you're more likely to have IBS as well. And there can be an event that causes the IBS to start. So many people will not have it and then develop it through either an accident, a stress episode, a bacterial infection, surgery, worry or stress or loss. So there's lots of reasons why people can go on to develop it, but they're not sure exactly why it happens, but there's many factors that can lead into that. So what I would say is not normal IBS symptoms. So if you're experiencing any of those pain, wind, bloating, gurgling, constipation, diarrhea, and you then develop unintentional weight loss or unexplained weight loss, or you start to experience something like rectal bleeding or high fevers, or if there's a family history of bowel cancer or ovarian cancer, or if you have change in your bowel habits for longer than 6 weeks compared to your norm, these are things that I would definitely go and speak to your doctor about, because what we want to prevent is people self-diagnosing, because there can be a big overlap with symptoms that sound like IBS, but that can be other things. So if you have any of those symptoms, plus any of the rectal bleeding, unintentional weight loss, family history of ovarian or bowel cancer, and changing bowel habits for longer than 6 weeks, I would urge that you go and discuss this with your GP. So there will be many of Slimming Clinic patients out there who have IBS and are trying to lose weight, but don't want to trigger off some of their symptoms. So what is the key to doing it successfully? So what I would say is IBS is very individual to each person. Many people's symptoms vary from one to the other, and it's not a one size fits all. So it's really knowing about you, knowing about your habits, and about your symptoms. We also have to try not to just blame food for our symptoms, because there can be many other reasons for your symptoms happening. So this could be due to a lack of sleep. So the studies that shown where your lack of sleep can influence how your gut behaves. There's definitely a link with mood. So lots of times what we're feeling and thinking in our head will have a direct effect on our digestive system and cause it to spasm, or to cause constipation, or cause urgency or diarrhea. So definitely look at what's going on in your life, and could stress be one of these issues? How you eat. So a sensitive digestive system does better with little and often, more frequent eating, compared to large and infrequent. So if you can imagine, if you're only eating one meal a day, and that's going through, and it's a large meal, it's going through your digestive system all at the one time, it means that your digestive system has to work much harder. So what you have to do is look at maybe eating more little and often. And the other thing that we often forget about is to chew our food. So the actual action of chewing will mix the bolus of food in your mouth with saliva, and that saliva starts to break down some of those carbohydrates and proteins in what you're eating. So try to avoid drinking and eating at the same time, because you're then washing away that saliva, which has such a vital role in food digestion. And also it's important to look at hydration. That can, if you're dehydrated, you're more likely to be constipated. And also, if as women, there can be a change in your digestive system habits in coordination with your hormone cycle. So just to be aware that before you start to blame the salad that you've had at lunchtime, start to look at what else is going on in your life. What is your mood like? What's your sleep like? How well hydrated are you? What's your pattern of eating, and how are you eating? And to look at, if you are a woman, to look at where in your cycle are you, and is that having effect as well? I often get my clients here at the Slimming Clinic to use a mood, food and symptom diary, and that just helps them track how they're feeling, what they're eating, and what their symptoms are like, to see if they can begin to pull a pattern of what's happening with them as well. So what are the keys to weight loss and not to exacerbate your IBS symptoms? So first of all, my advice for trying to lose weight with IBS is to concentrate on protein. With coming to the Slimming Clinic and wanting to lose weight, what we're looking for is satiety. We're looking for you to feel full and satisfied. And one of the lovely things that comes with eating protein in our diet, it releases hormones when we eat it, which gives our body signals that it's full. So if you're trying to lose weight, the first thing I would look at is what's the protein content of your diet. So protein containing foods are things like eggs, fish, meat, chicken, beans, lentils and pulses, and tofu. And what I would encourage to do is that at each meal and each snack that you have some sort of protein. Again, that will just make you feel fuller and satisfied. Some meats are hardest to digest, so things like red meat can be harder to digest with a sensitive gut. So maybe having it something like stewed or braised starts to break down those tendons in the meat, which makes it easier for you to digest. The other thing is, as well, is to make sure that you're chewing it well while you're trying to eat it. Again, starting the digestion off in your mouth and not relying on your stomach. With having IBS, lots of clients can have trouble with things like beans and lentils and pulses, and that's just because we don't actually have the enzyme to break beans and lentils and pulses down. But if it only causes wind, then that is normal. But if it brings back pain, bloating, urgency, constipation, gurgling, then that's not normal. So how you can eat beans and lentils and pulses with having IBS and trying to lose weight is I would look at the portion size that you're having at a sitting. So potentially looking at having 40 grams of chickpeas or lentils at a meal time. And the other thing you can do is, if you have them tinned, you can wash them, boil them again. It makes them much easier for them to be digested. The other thing I'd say with beans and lentils and pulses is just to be careful what you're mixing it with. So if you were to have like a chickpea curry that had onions and garlic and chickpeas in it, you might find that's harder to digest and maybe gives you more symptoms. So maybe if you're having a curry with chickpeas, use things like garlic infused oil and maybe a herb like asafoetida or the green part of a spring onion to give you those aromatics. Sometimes lots of those foods are harder to digest, and when you clump them all in one meal, again, that can bring back some of the symptoms of pain, wind and bloating. So as I said, protein is really important for weight loss, but you just have to be careful what type of protein that you can tolerate. So on top of protein, the other thing that gives us satiety helps with weight loss is fibre. So it's really important that we make sure that you have adequate fibre in your diet. The issue with increasing fibre too quickly is that it can have an effect on your digestive systems. So my advice is to anybody that has IBS or is trying to increase their fibre is to do it slowly. Your gut does better training it to tolerate with this indigestible fibre. So as I said, the key is to increase the fibre slowly and to find your tolerance level. The guidelines for fibre is 30 grams of fibre a day, but many people who have IBS will struggle to get up to that 30 grams of fibre a day. What it does is it draws water into your digestive system and again makes you feel fuller for longer. And also it gives you satiety because you've got to chew it. And so therefore, again, it sends messages from your jaw to your brain to tell you that you're full because you're having to chew more of this fibrous food. If you're wanting to start to increase your fibre and you're anxious that it's maybe going to trigger off your IBS symptoms, what I would do is I would choose fruits and vegetables that are less fermenting. There's certain fruits and vegetables that cause much more fermentation in your large bowel, and that fermentation is what causes the pain, it causes the bloating, it causes the wind. So certain vegetables like carrots, green beans, turnip, peppers, courgettes, aubergines are much easily tolerated compared to things like cauliflower, broccoli, asparagus, onions and garlic. So choosing a slightly less fermentable vegetable might be easy as you start to try to increase your fibre intake. And from a fruit point of view, I would say having things like kiwis, slightly unripe bananas, blueberries, strawberries, tangerines are much easier to be digested compared to things like apples, pears, nectarines, peaches, plums, mango, watermelon. They all do have a bit more fermentation when they reach your large bowel. If we're talking about fibre, we need to talk about hydration. So as I said earlier on, some symptoms can be triggered off by dehydration. So it's really important. It's one of the most important things I talk about to people who are trying to lose weight is really making sure that you're getting enough hydration in your diet. Often we can think that we are hungry, and in actual fact what we are is dehydrated. So again, if you're trying to lose weight and you're feeling hungry at points, you just need to check your fluid intake. And if we're going to start to gradually increase that fibre in your diet, you need fluid there, because the fibre draws fluid into that large bowel to make it easier for you to pass a motion, and so therefore you don't want to be dehydrated. Otherwise it can make things like constipation worse, because things just take much longer to go through your digestive system. So the golden rule for hydration is, to be aiming for around about, depending on your size, but to be aiming for around about 2 litres of fluid a day. And to sip this gradually over the day, and not to just drink one big drink at a time, because that'll just go straight to urine and will not hydrate your body. So you want to gradually sip water over the day and keep on top of your hydration levels. And it can be things like decaffeinated teas and coffees, water, diluting juice. But if you are trying to lose weight, you just have to be cautious of the extra calories that are hidden in some of these fluids. So be careful with the skinny lattes, the fruit juices, the milkshakes, the protein drinks. Just be careful that it's not tipping you over your calorie requirement for weight loss. So as well as looking at the foods that make you feel fuller, so making sure that you're having the protein and the fibre and the hydration, for IBS, we would advise that you looked at your overall diet and how processed it was. So I find that people who have IBS do better with more natural foods compared to processed foods. So processed foods can have too much fat in them, they can have too much sugar, chemicals, preservatives, and all these things can be triggers for IBS symptoms. Also for weight loss, these are the biggest calorie hitters. And by reducing things like your crisps, your chocolate, your cakes, ready-made meals, pizzas, generally you're going to reduce your calorie intake as well. And processed foods tend to have less nutritional value compared to unprocessed foods. So they tend to offer you less. They tend to have less fibre in them. They tend to have less potassium in them, which you get from more fruits and vegetables. They tend to have less antioxidants, polyphenols, all the very protective factors that come from more natural foods. What I would also say as well is that processed foods tend to be higher in salt. So quite often I'll get people that will say to me, oh, on Friday, my weight loss was looking good, I was on track, but then over the weekend I tended to have a few more takeaways or had more processed foods, and now my weight's back up on a Monday. So what I would say is if your diet is higher in salt at the weekend from processed foods, then what that does is it just retains body fluids, so therefore you're getting a higher reading on the Monday morning. So you just need to be careful with the amount of processed foods that you're having. And especially if you've got IBS, you really want to know what is in your food to see if it's one of these things that you're going to trigger off against. So the other part would be carbohydrates. So carbohydrates are really important for energy release, and they offer us a good source of fibre. But with having IBS, quite a lot of clients find that they can't tolerate certain carbohydrates. So they may have issues with things like wheat, they may have issues with things like gluten, oats, barley, rye. So it's really important to find a carbohydrate that suits you. So I find quite a lot of people with IBS tolerate rice better. They tolerate rice noodles, quinoa, buckwheat. These seem to be milder on your digestive system. But what we do want to do is we want to make sure that if you are having carbohydrates, that to try to ensure that they are whole grain, because again, they've got that fibre in them that's going to make you feel fuller for longer. So I would recommend that if you are having rice, to try wholemeal rice, brown rice, to try wholemeal noodles. To also have things like the quinoa and the buckwheat, because again they kind of add an extra fibre, and to have beans and lentils and pulses in a quantity that you can tolerate, because again these are a fibre source but they're also a carbohydrate source as well. And it's about building your tolerance to it. So what I would say is that overall it's knowing yourself and knowing your symptoms and knowing your triggers, but there's no reason why you can't have IBS and still lose weight. So my take-home message from this is with having IBS and wanting to lose weight, you want to make sure that you're eating regularly. So you're having a breakfast, lunch and dinner and some small snacks, and not eating large and infrequently. You want to make sure that you're chewing your food well, again, to make sure that the saliva is mixing through with what you're eating, so making it easier to digest. Keeping that hydration up, so making sure that you're having that 2 litres of water a day. And if you're exercising, taking extra water on top of that. And to make sure for satiety and making sure that you feel full, that you're looking to have protein at each one of your meals, plus your snacks as well. And trying where you can to increase that fibre in your diet. And with having the fibre, you want to do it slowly. You want to make sure that your gut can tolerate it. And if you're choosing fruits and vegetables, try to choose ones that are maybe less fermenting and less likely to cause wind, pain and bloating. Just look at the grouping of them. So, if you have lots of wind containing vegetables in an evening, try to choose alternatives so it's maybe less likely to give you symptoms. So I hope this has been of help. If there's anything you want to ask, just message below and I'll be happy to help. So take care. Thank you very much. Bye.